Welcome to This Explainer. Today we're diving straight into the unexpected and honestly totally hidden blind spots of cardiovascular disease. We're going to shatter some outdated stereotypes along the way. I'm thrilled to be your guide today as we explore some truly fascinating research. Look, we usually think of heart disease as a pretty straightforward issue, right? Like maybe you eat too much junk food or you just don't jog enough. But today we're looking at the silent, often completely invisible factors that are quietly impacting millions of lives. So let's kick things off by challenging some of your assumptions about who actually gets heart disease and why. If you were to picture a typical heart attack patient right now, who comes to mind? Is it an older, stressed out executive? Maybe someone who spent a lifetime smoking? Now, while those factors are absolutely relevant, the modern landscape of cardiovascular health is shifting rapidly. The data is telling us a completely different story, one that involves our unique anatomy, the latest diet fads, and, yep, even the very desk you might be sitting at right this second. It might actually shock you to learn that roughly 1/3 of all deaths globally are attributed to cardiovascular disease. That makes it the literal #1 killer worldwide. Just to put that into perspective, in 2015 alone, it claimed the lives of about 8.5 million women. But despite this staggering, massive figure, our understanding of how this disease operates is riddled with blind spots. Historically, the medical field has treated this as a primarily male issue, and that outdated assumption has created a massive and sometimes fatal knowledge gap.
Section 1. The Gender Diagnostic Gap. Let's look at women's hidden risks.
See, because so many early clinical trials basically excluded women, assuming that drugs working for men would naturally just work for everyone, we've ended up with this huge diagnostic gap. While men often experience that classic Hollywood heart attack, the crushing chest pain or the pain radiating down the left arm, women frequently present with atypical symptoms. We're talking severe unexplained fatigue, pain in the jaw or neck, nausea, and lightheadedness. Because these symptoms are kind of vague, they are dangerously easy to misdiagnose as a simple gastrointestinal issue, or worse, just stress and anxiety. And these symptom differences, they aren't just random. They stem directly from human anatomy. Women generally have smaller blood vessels and a smaller ventricle size than men. Because the vessels are narrower, a blockage that might be considered minor or totally manageable in a guy can cause catastrophic damage in a woman. And since the ventricle is smaller, it pumps out less blood per beat. That means a woman's heart literally has to beat faster just to distribute the exact same amount of oxygenated blood around the body. Furthermore, the risk factors themselves look entirely different. Female-specific life events drastically elevate cardiovascular risk. For instance, pregnancy complications like gestational diabetes or preeclampsia can leave irreversible changes on the vascular system. Then there's menopause, which triggers a sharp drop in estrogen, and estrogen is a hormone that provides massive cardioprotective benefits. Oh, and let's not overlook autoimmune diseases, since women make up the vast majority of autoimmune patients. If a woman has systemic lupus, for example, she can actually be up to 9 times more likely to experience a heart attack compared to the general population. Absolutely wild, right? Okay, moving on to Section 2, the fasting paradox, diet trends and the heart. So we've talked about biology, now let's talk about the diet trends completely taking over social media. You've likely heard of time-restricted eating, which is a highly popular form of intermittent fasting. The most common method out there is the 16-8 method, basically fasting for 16 hours and cramming all your meals into a strict 8-hour window. The appeal is huge, and it's heavily praised for helping people manage weight, improve insulin sensitivity, and burn fat. Sounds like a total win for your heart, doesn't it? Well, a recent analysis presented at an American Heart Association conference looked at over 20,000 U.S. adults and revealed a genuinely shocking statistic. Individuals who limited their eating to a strict 8-hour window actually had a 91% higher risk of dying from cardiovascular disease compared to those who ate across a more traditional 12 to 16-hour day. No way, right? This right here is what we call the fasting paradox. While skipping breakfast and fasting might help you lose a few pounds and even lower your bad LDL cholesterol in the short term, completely overriding our natural biological rhythms seems to place a hidden long-term metabolic strain on the heart. Now, we don't fully understand all the underlying mechanisms just yet, but it strongly suggests that strict eating windows might not be the universal heart health cure-all they're marketed to be, especially if you already have pre-existing conditions. Which brings us to Section 3, Occupational Hazards and Workplace Heart Risks. Beyond our diets and biology, another hidden accomplice in heart disease is the place you probably spend most of your waking hours, your workplace. We all know firefighting carries extreme risks, right? Cardiovascular disease accounts for 45% of on-duty firefighter deaths due to extreme physiological strain, heat stress, disrupted sleep, and those massive spikes in adrenaline. But standard white-collar or service workers, they carry their own severe silent risks. Being completely sedentary all day, combined with chronic psychological stress, is a highly potent recipe for cardiovascular decline. For office workers, the danger usually comes in the form of job strain. Job strain is essentially a toxic combination of high demands, low control over how you actually do your work, an imbalance between your effort and your reward, and chronic job insecurity. This isn't just about feeling stressed out or having a rough week at the office. This specific combination keeps your nervous system constantly activated, driving up your blood pressure and promoting deep inflammation in your blood vessels day after day. If you think grinding through endless overtime is just the price of success, you really need to consider this staggering data from a joint World Health Organization and International Labor Organization study. Working 55 or more hours a week massively spikes your risk of a stroke by 35% and your risk of dying from heart conditions by 17%. The hustle culture we so often glorify is quite literally breaking our hearts. Finally, Section 4, Protecting Your Heart with Actionable Prevention. So now that we've exposed these hidden dangers, from the gender diagnostic gap to the fasting paradox to the silent threat of job strain, how do we actually mitigate them? Well, it requires a pretty holistic approach. Step 1, prioritize consistent nutrition and exercise over extreme fasting fads. Eat whole foods and move your body to naturally lower your blood pressure. Step 2, stop smoking, which immediately reduces plaque formation in those vulnerable blood vessels. Step 3 is all about managing job strain. You've got to set strict work-life boundaries and push back against those routine 55-hour weeks. And step 4, particularly for women, is to actively advocate for your symptoms. Never, ever let a doctor dismiss sudden jaw pain or extreme unexplained fatigue. As we wrap up this explainer, I want to leave you with a question to ponder about your own life. Are the habits, jobs, and diets you completely trust actually protecting your heart, or are they hiding right there in your blind spot? True health means looking past the stereotypes and paying real attention to what your unique body and your daily environment is telling you. Thank you so much for joining me today, and keep asking the right questions about your health.